psycho-oncology is a special field within psychology where we deal with cancer patients. Something very, very special about psycho-oncology is that you do not just deal with patients who are suffering with cancer, but also their family members, their friends, their primary caregivers, their secondary caregivers, and so on. So the qualifications required to be able to practice as a psycho-oncologist till now in India are that you need to have a master's degree in psychology. But of course, because this topic in this subject is not included in most of the university's curriculum in bachelor's or in master's, it is very, very important and required that you do some courses and training in this to make sure that you are helping the patients and not harming them. With my own experience of working in the field of psycho-oncology for more than 3 years now, I can definitely say that the opportunities which are coming up for psycho-oncologists is increasing day by day. A lot of NGOs are now coming up in order to help the patients who are diagnosed with cancer, and they mostly hire psychologists as well. And so yes, the opportunities in this field are increasing day by day, especially in India, and in abroad it is a very well established field. The basic qualifications to be able to practice as a psycho-oncologist in India is that you require a master's degree in psychology. However, the rules might change in future, but as of now this is the case. There are a few universities like Christ University who have come up with masters in psycho-oncology. So if you are very interested in the field and sure that this is something that you want to pursue, you can definitely do masters in that also. However, I would like to add that if you have already completed your masters, or if you are not comfortable pursuing your masters in one particular subfield as it affects your future job opportunities, you can do your masters in psychology or in counseling psychology and pursue some training and certification courses in psycho-oncology instead, so that the job opportunities increases and you can practice with a wider population. I actually cannot stress enough the importance of getting trained and attending courses and workshops in the field of psycho-oncology, because this is something which is completely missing from our curriculums even at the master's level, and hence it increases the importance of getting trained in this if you have a desire to pursue this career ahead. Unfortunately, I cannot give you one number for a salary of a psycho-oncologist, but yes, if you get hired as one, you will definitely get paid as according to the industry standards, and because it is a very specialized field, you might even get paid more than a counseling psychologist does, because this is a very special field. Just by doing your masters, you might not be equipped enough to deal with cancer patients, and hence training is required, and this will definitely increase your chances of getting a better salary. So when we talk about palliative patients, we usually think that these are the patients who are in their end of life, but that is not the case. Palliative care simply means the care which is being provided to the patients apart from the main treatment. So pain management is also a part of palliative care. The psychological treatment might also be considered as a part of palliative care. So any treatment and care which is being given to the patients apart from the main treatment for the disease or the illness that they are suffering with is known as the palliative care. When you talk about the patients who are in denial, we need to approach them with great care and a lot of expertise and skills, and this is why learning about psycho-oncology becomes so important, because until and unless you are trained in it, you might end up actually harming the patient. So somebody who's in denial, there is a technique which we call breaking bad news, and that actually depends on how the patient is perceiving the information and what are his past traumas and how does he see this illness, have the experiences related to this illness been very negative, has the patient lost people to this illness, and what all. So a lot of factors actually define and affect as to if the patient actually is in denial, and if yes, how do we deal with them. So very rightly said by you that the first reaction of everybody is shock. whenever we get to know that somebody who's close to us has been diagnosed with cancer, the first reaction is shock, and it becomes extremely important to first take care of our emotions. And we need to actually understand the role that we are going to play from that time onwards. Am I going to be a primary caregiver? Am I going to be a secondary caregiver? Am I just going to be an emotional support to the person, or am I also going to fulfill the role of a psychologist? Because most of us talking over here are mental health professionals, and first we need to be sure of the role that we are going to take, and of course we need to deal with the person with a lot of love and care. Well, I'm not sure if this would be the right thing to say, because the treatment of cancer is extremely difficult, and as psycho-oncologists, we try to provide them a space in therapy which is absolutely safe for them to feel all their emotions, to feel weak, to feel vulnerable, to feel that yes, they are going through a very difficult time, and hence they are allowed to feel all the negative emotions. And saying something like that might actually add a pressure on them to feel strong, and if they are not feeling strong, they might feel as if they are incapable, or if they have any deficits in them. So I would not say that it is the perfect thing to say. So a very important aspect of cancer diagnosis and treatment has been brought on about you, and that is that people usually perceive that now once the cancer has been detected, it is going to be the end and this is going to terminate in death itself. But that is not the case, and it is very, very important that the patient and the family is informed about this. And in psycho-oncology, as mental health professionals and as family members or even caregivers, this is something that we need to reinforce again and again, that this illness is now treatable. A lot of cancers in the initial stages are now treatable, and a lot of patients do recover and enter into what we call survivorship. And once you have been diagnosed with cancer, it doesn't necessarily mean that you are going to die. This also leads to reduced levels of resilience, quality of life, pessimism in the patients, which in turn affects the physical treatment as well. So it becomes extremely important to Absolutely, and very well said that we should never hesitate in talking to people who have cancer or any other chronic illness or even mental health conditions, because all of these conditions are very isolating. There are a lot of people that they lose in the process of the treatments of such chronic illnesses, and it becomes very isolating for them. They suffer with identity crisis because the entire role and the dynamics of the families also change. So it becomes extremely important that they get the emotional support from wherever possible. We definitely need to be sure of the role that we are playing. Are we helping them as friends? Are we providing our services as psycho-oncologists and mental health professionals, or are we being the primary caregivers? So this distinction definitely is important. But if you see anybody around you who has been diagnosed with cancer, make sure that you are reaching out to them and that you are offering your So what you are saying is very relatable, and I'm sure a lot of people are going to relate with it. We often feel at a loss of words, and we do not know how to talk to people who have been diagnosed with cancer or any other major chronic illnesses. But if we make distance with them, if we do not talk to them, or if we avoid speaking to them about the elephant in the room, it makes them feel even further isolated, and it makes them feel secluded from the rest of the population, which further adds on to their psychological issues and concerns. So gather up the courage and get trained in this, and know the right things to say, but do communicate with them so that they do not feel secluded and isolated. Yeah, so offering your help in doing the daily course that they're finding difficult, or maybe taking them to and fro the hospital sometimes, or helping them cook or anything. So just go ahead and ask them if they need help in anything, and if they say yes, please do help them. Very rightly said, and I'm sure this is going to help them very much. Understanding the procedure for fighting cancer, understanding that yes, this is treatable, this is not the end of the world for you, is the first step for any cancer patient and their families, because usually we associate the word cancer with death. So understanding the procedures, expecting what is to come and what might happen, what might not happen, is extremely important.